Hello, my name is Kim Narker and I'm the founder and owner of Stretch Physical Therapy and Total Wellness. Today we're going to be talking about back pain. Back pain typically has three common causes that are pain with bending forward, pain with bending backwards, or perhaps pain when you're leaning to one side or the other side. Those symptoms actually are coming from either a herniated disc, some type of spondylolisthesis or spondy type diagnosis, but also could be coming from a sacroiliac dysfunction or just generalized low back pain for reasons of instability or lack of mobility. Today we're talking about low back pain in terms of testing to see if you have restrictions in your joints that could cause you to have limited lumbar or hip mobility. And when you have decreased mobility and joint restrictions that decrease your mobility, then the muscles that support the spine and hips aren't working the way they're supposed to. And when they don't work the way they're supposed to, then you can actually increase back pain and increase complications from actually compensating when you're pushing, pulling, lunging, bending, twisting, and doing functional activities. So for the sake of today's video, I'm going to test the lumbar spine to see if there is limited mobility in the lumbar spine that could be causing back pain. I'm also going to show you a simple test to see if your hip is actually restricted as well. If you don't have mobility in the hip and you go to perform an activity that requires that hip mobility and you get to a point where the hip can't move anymore, then that activity that you're doing, you're going to be able to do it, but you're going to put a strain on the low back or other areas when doing that. So go ahead and get comfortable, and I'm going to walk you through 3 simple tests that you can do in the comfort of your own home to see if you have joint restrictions and if those joint restrictions could be causing your back pain. So I want you to start off by laying on your side. I want your knees stacked in a comfortable position. And I want you to take your bottom hand here and put on the top of the knee here. Now, for the sake of this video, I'm going to slide my bottom leg so that you can see that I can hold this down. I'm going to take this hand and put it on my belly button. Now, I want you to rotate this shoulder backwards, and I am extremely tight. So this shoulder is supposed to go all the way back and touch the table. Now, if you feel that in your thoracic spine, then that means you have thoracic restrictions. If you feel that in your lower spine, it means that your lumbar joints are not moving the way they're supposed to move. And that means you have a positive test for a lumbar joint restriction. So again, hand here and press back. And when you're pressing back, I don't want you to roll back this way. I want you to keep that knee down, flat, and roll back as far as you can roll. If your shoulder does not touch the table, then you actually have a joint restriction on the right side or possibly the left side in the lower lumbar spine. Now, to test the other side, I want you to roll over to the other side. And you're in the same position. So you're going to take and hold the hip down, and you can still straighten that leg so that you can lock out the lumbar spine. Hand on your belly button here, and then you're going to take this shoulder and go back as far as you can go. And if you see here, I have a lot more mobility on this side, but I still don't have full mobility because my shoulder is not touching the table. But when I go back in this direction, I'm not feeling the tension that I felt on the other side. That means I have more mobility on the left side of my lumbar than I do on the right side of my lumbar. But if you see here, I still don't go completely down. So that is still a positive test, meaning that my lumbar joints are not moving and mobile the way that they should be. Now, if you cannot get into those positions and your shoulder does not touch, then that just means that you can get some manual therapy from a clinic like ours that can actually release those joint restrictions and improve the mobility so that you can decrease your back pain. So, self-test number 2 to test for your hips movement is I want you to lay on your back. All right, so in this position, I want you to lower down the left leg. I want you to bring the right leg up, and I just want you to bring it to the point where you can't bring it anymore. I don't want you to pull it or anything, just where you bring it back as far as you can. Most people will feel a catch in here. And if you can't bring your leg up and touch right here easily, then there's a joint restriction in your hip that's limiting your hip mobility. And that just means that this hip has a restriction that can benefit from stretching of that joint. Now, to test the other side, it's the same thing. Bring it up as far as you can. And this leg, I have the same thing. So I have 2 hips that have a restriction. Now, I can pull through, but when I pull through, I'm actually compensating from other areas because the hip is not moving the way that it's supposed to be moving. So, if you have lumbar restrictions and you've tested your hips and you have hip restrictions, then you have the ability to seek out conservative care that can do joint stretching that will help improve the mobility of your hip and back to decrease your back pain. Now I want to show you one more self-test that you can do at home, and we're going to test our right leg. And I want you to lay on your side again. And this top leg, I really just want you to be comfortable. This bottom leg, I want you to be at a straight angle here so that you pull it up here and hold it here. But drop that foot off the table and watch it go down. Now, a normal test for this should go down a little bit further than mine is. But mine is not really bad. If yours, you're here or here and it doesn't go down here, then that just means you have a joint restriction into internal rotation, and that joint is restricted not just in forward movement, but also in a rotational component. Those are the top 3 components that we find that people that experience back pain have limited mobility in. So, if you tested your back, your hip, and then that last exercise and found that you had restrictions in any or all of those areas, then you have a potential for gaining that mobility back with the techniques that we use in our clinic here at Stretch Physical Therapy. So perform those tests. If you feel like you have joint restrictions and you don't have the mobility that you need, then our programs will be beneficial for you. I hope you found this helpful and you learned more about some self-tests that you could do in the comfort of your home. If you should have any questions that you need answered, please feel free to give us a call at 513-874-8800. You can also visit us at our website at www.stretchphysicaltherapy.com. Thanks so much and have a great day.